So the general adaptation syndrome is a generic response to stress that is common among all animals. It's comprised of 3 phases irrespective of the stressor. So the first phase is the alarm phase, where the body is caught off guard, and so the effect of the stressor is realized. The second phase is the resistance phase. The body tries to adapt to achieve homeostasis under the changed circumstances. The third phase is the exhaustion phase. If adaptation fails to achieve homeostasis, the body's resources are depleted. The stress response is governed by the hypothalamic, pituitary, and interrenal axis. Adrenocorticotropic hormone and corticosteroids have a number of effects on the body. There's an increase in blood glucose and an increase in nitrogen metabolism. Sodium and chloride are retained, and potassium is excreted. There's an increase in thyroxine output, and there's also delayed leukocytic infiltration in inflammatory lesions, with delayed wound healing and a shift in the inflammatory population, resulting in fewer lymphocytes and larger numbers of neutrophils, with depopulation of lymphoid tissues throughout the kidney and spleen. Catecholamines of the sympathetic nervous system also have a number of effects on the body as part of the fight or flight response. Splenic contraction will increase the hematocrit. There's also increased respiration, an increase in the heart rate, an increase in heart contractility, and an increase in blood pressure. Secondary effects in circulation, osmoregulation, and energetics include an increase in blood glucose via glycogenolysis and an increase in circulating free fatty acids, which is associated with an increase in the metabolic rate and an increase in the amount of blood to the gills with decreased chloride secretion. There are a number of potential consequences to stress. If the animal is able to resist the stress, it suffers an increased susceptibility to infection by pathogenic bacteria. If the animal is exhausted from the stress, there's increased susceptibility to infection by non-pathogenic bacteria. For this reason, perimortem infections involving environmental and intestinal bacteria are quite common. Spawning salmon are subject to extreme levels of stress. This is a result of a number of factors, including hormonal changes, starvation, travel exhaustion, and osmotic disturbances, given that they're transitioning from the marine to the freshwater environment. If you perform a necropsy on a spawning salmon, you'll notice that there's hyperplasia of the pituitary gland and adrenal gland. This is associated with a significant increase in 17-hydroxycorticosteroids. As a result of this stress, spawning salmon tend to succumb to bacterial and fungal infections, which is why a lot of them look like they're rotting even though they're still alive. Temperature is one of the most important stressors. Temperature can have a number of effects on the host-pathogen relationship. For the host, temperatures will have an effect on the levels of dissolved oxygen, the rate of metabolite excretion, the immune response, the phagocytic capabilities of macrophages, inflammation, and wound healing. For the pathogen, temperature will affect the rate of microbial replication. Infection is more likely to occur when there's a rapid change in temperature or at temperatures approaching the extremes of survivability. The inflammatory response is a defensive response to tissue injury. Causes of tissue injury may include trauma, infection, radiation, chemical injury, and toxicity. The rate of the inflammatory response is temperature dependent. Inflammatory cells and other components of the response maintain homeostasis, fight against infection, and repair tissues if necessary. Tissue necrosis results in the release of vasoactive amines and other cell breakdown products. This results in a dilation of capillaries, an increase in blood flow, and increased vascular permeability. This in turn results in a leakage of fibrinogen, immunoglobulins, complement components, and antimicrobial compounds. Thrombocytes mediate the polymerization of fibrinogen to fibrin. There's also migration of inflammatory cells from circulation into the affected tissues. The composition and the severity of the inflammatory infiltrate will vary depending on the insult. Neutrophils are generally part of the first response. Following phagocytosis, lysosomes digest ingested organisms. Lysosomes can also be released into the surrounding environment when the cell dies, causing tissue liquefaction. Neutrophils are not a common or major component of the inflammatory response in fish. Monocytes arrive from circulation, whereas tissue macrophages are already on site. Tissue macrophages can multiply in situ, so it's not uncommon to find mitotic figures within areas of inflammation. Macrophages are the dominant cell type in the inflammatory response, and they're responsible for the phagocytosis of debris and foreign antigens. They can also form multinucleated giant cells. Lymphocytes are less common. These are part of the cell-mediated immune response, and you're more likely to encounter them with chronic inflammation. Thrombocytes are involved in hemostasis. They release thromboplastin, which is responsible for the polymerization of fibrinogen to fibrin. The outcomes of inflammation are dependent on a number of factors. Resolution will occur if the damage is minimal and the insult is removed. If inflammation is sustained, you get a continued response which varies depending on the tissues and the stimulus. Neutrophilic exudation is characteristic of bacterial infections. Serous effusions can occur in the peritoneum and the pericardium. This could be evidence of systemic inflammation. Fibrinous exudates occur in highly vascularized tissues. This is evidence of increased vascular permeability and is often in response to bacterial infection. Catarrhal exudates occur on mucous membranes, and they're generally composed of an amalgam of fibrin, mucus, and cellular debris. Vacuolar degeneration is evidence of reversible cell injury. If the insult is not removed, this will progress to necrosis. There are various patterns of necrosis depending on the insult. Liquefactive necrosis is caused by neutrophilic and bacterial enzymes. Neutrophils release proteolytic enzymes from lysosomes, causing cellular lysis. The rate is dependent on the tissue and the temperature. Coagulative necrosis is evidence of ischemia or toxin exposure. Toxins can be bacterial or environmental. Fat necrosis typically occurs as a result of oxidative injury, and it will result in saponification. Chronic inflammation generally ends with fibrosis and granuloma formation. Fibrosis results from a proliferation of fibroblasts and a deposition of collagen. Granulomas typically form in response to foreign material, whether it's Mycobacterium, Renibacterium salmoninarum, or fungal hyphae. The basic composition of a granuloma is a central core containing the foreign agent, surrounded by cellular debris and variable degrees of dystrophic mineralization. The central core is surrounded by epithelioid macrophages and multinucleated giant cells. The layer of macrophages is then surrounded by fibroblasts and collagen deposits with lymphocytic infiltrates. The image on the right is a classic example of a fish granuloma. Compared to a mammalian granuloma, there are higher numbers of macrophages and fewer fibroblasts. Now we'll get into the specific responses of the various systems, starting with the integument. As previously mentioned, the cuticle is lost in routine histological preparations. The cuticle can change in thickness and consistency in response to toxin exposure and infectious etiologies, like protozoa or bacteria. The mucous cells secrete the cuticle and transport various components to the skin surface, including lysozymes, complement components, C-reactive proteins, kinins, and antibodies. These compounds are used in defense. A loss of the cuticle will allow bacteria and fungi to colonize the exposed epidermis, resulting in infection. The image below is an example of bacterial dermatitis, where you see evidence of scale loss, epidermal erosion, epidermal ulceration, hyperemia, and excess mucus production, resulting in a thickening of the cuticle. The epidermis can react in a number of ways. Spongiosis, also known as intercellular edema, is a response to acute inflammation. The Malpighian cells of the epidermis are held together by intercellular junctions. Edema within the epidermis will cause mild dissociation of the Malpighian cells. However, the intercellular junctions will remain intact. This will give the Malpighian cells a spiny-looking appearance. Epidermal hyperplasia is a generalized response to irritation, whether it's in response to chemical pollutants, bacteria, or hormonal stimuli. Proliferation of the Malpighian cells will occur at all levels of the epidermis. Chronic inflammation of the epidermis will be associated with intraepidermal lymphocytic infiltrates. Within the images below, you can see all three of these processes occurring simultaneously, including epidermal proliferation, spongiosis, and intraepidermal lymphocytic infiltrates. With sufficient injury of the epidermis, the melanophores may rupture, resulting in pigment dispersion. The free pigment may accumulate within epidermal cells and macrophages. Epithelial degeneration and necrosis can occur in response to a variety of insults. Examples include bacterial toxin production within the dermis and jellyfish stings. The image below is an example of what happens when a fish is stung by a jellyfish. You'll notice two patches where the epithelial cells are swollen, dissociated, and undergoing degeneration. Ulceration is defined as a loss of the continuity in the epidermis and a breach of the basement membrane. Dermal ulceration is associated with an increased risk of infection. In marine fish, there's also a loss of tissue fluid, resulting in osmoregulatory disturbances. In freshwater fish, the opposite is true, where water will enter the body given that the fish exists within a hypotonic environment. Any insult to the epidermis can lead to ulceration and secondary microbial invasion. Examples include bacterial, fungal, and oomycete infection. A damaged epidermis is quick to heal. There are a number of different stages in wound healing. Firstly, the surrounding Malpighian cells will release their intercellular junctions and migrate over the area of ulceration before linking up again. This process is known as re-epithelialization. The process is independent of temperature, and the surrounding epidermis is reduced in thickness as a consequence. In some cases, you may have a single layer of epidermal cells covering the defect. The whole point of this process is to restore the barrier against osmotic imbalances and infection. Migration is inhibited if bacteria are present. The next step is proliferation of the re-established epithelial barrier. This is a temperature-dependent process. As wound healing progresses, there's eventual fibrosis of the damaged dermis. The gills are delicate and vulnerable to injury given that they're constantly exposed to the environment. Causes of injury include chemical exposure, infection, and trauma. The gills are particularly prone to parasitic infection because they receive a rich supply of nutrients and they're protected by the operculum. These are ideal conditions for your average parasite. Bacteria, viruses, and foreign particles can be absorbed by the gills, so this is a potential route of infection. Fish can survive with moderate gill lesions because catecholamines can redirect blood to less used lamellae, increasing their functionality. In other words, the gills have a large functional reserve. Systemic bacterial infections are fairly evident in the gills because they're highly vascularized with narrow looping capillaries. The gills may respond to injury in a number of ways. Lamellar edema is the result of increased vascular permeability. Elevated arterial blood pressure will result in a lifting of the epithelium and an accumulation of fluid, similar to a blister. This will progress to epithelial necrosis and sloughing. Sloughing of the lamellar epithelium can result in massive osmoregulatory disturbances. Potential causes of increased vascular permeability include algal toxins, pesticides, hydrogen peroxide, and heavy metals. Causes of epithelial necrosis include chemical injury, mechanical irritation, and jellyfish stings. The image at the bottom right is an example of lamellar edema. You can see a pale pink fluid accumulating between the lifted lamellar epithelium and the lamellar capillary. Lamellar epithelial hyperplasia is a chronic response of lamellar epithelial cells to low levels of irritation. The cells replicate at and migrate from the filament to the secondary lamellae. In severe cases, these cells will fill in the interlamellar space, resulting in fusion of the adjacent lamellae. Mucous cell hyperplasia can occur at the base of the lamellae. However, this depends on the insult. This will result in an accumulation of mucus and a thickening of the cuticle over the gills. This can interfere with respiratory function, specifically gas exchange. It also provides a substrate for bacterial growth. An accumulation of cellular debris within the mucus can also serve as food for bacteria. Chloride cell hyperplasia can occur in response to acid rain and aluminum accumulation. Hyperplastic changes can resolve within a month if the stimulus is removed. The image on the bottom right is an example of severe lamellar epithelial hyperplasia with associated lamellar fusion. In other words, the feathery filaments turned into bricks, resulting in a massive loss in surface area. This would have had a significant effect on gas exchange. The lamellae can also fuse together in the absence of lamellar epithelial hyperplasia. This can occur as a result of a loss of mucus and a loss of surfactant, wherein the tips of the adjacent lamellae become sticky and fuse together. Potential causes include ichthyobotonecator and acid rain and aluminum exposure. Telangiectasia is a term used to describe aneurysms that form within the lamellar capillaries. This is the result of pillar cell injury. So pillar cells are like spokes that separate the two sides of the lamellae and maintain the structure of the vascular channels, as illustrated in the diagram in the bottom left. Certain insults like trauma, chemical injury, and parasite infection can cause pillar cell necrosis. Once the capillaries become ectatic, turbulent blood flow will result. This will create hypercoagulable states, resulting in thrombosis and eventual fibrosis following clot maturation. The image on the bottom right illustrates what telangiectasia looks like in histological section. The ventricle is divided into an outer compact layer and an inner spongy layer. The compact ventricle receives oxygen-rich blood from the gills. The atrium and spongy ventricle receive deoxygenated blood from the sinus venosus. Certain infectious agents have a tropism for the heart, like Piscine myocarditis virus. Systemic infections can also affect the heart. Examples include fungi, bacteria, and protozoa. Infection is associated with vascular congestion and vasculitis, particularly when the infection involves fungi and oomycetes, which have a tropism for vessels. Toxic myocardial necrosis is a condition that results from exposure to bacterial toxins. Examples include Aeromonas and Vibrio. The condition is characterized by myocardial degeneration and endothelial necrosis, with associated vascular congestion. Vitamin E deficiency can also affect the heart, specifically the cardiac myocytes of the ventricle. Histologically, affected cardiac myocytes undergo atrophy, followed by a loss of striation, hypereosinophilia, and coagulative necrosis. The image to the right is an example of myocardial degeneration and necrosis, with associated histiocytic infiltrates. You can see the overlying endothelium remains intact. The endothelial cells within the affected area are hypertrophied. Heart failure is associated with a number of lesions, including ascites, also known as dropsy, and exophthalmia. You also tend to see vascular congestion throughout the body, particularly within the body wall, the gonads, the intestine, and the liver. You might also see zonal hepatic necrosis as a result of ischemia from passive congestion. The image to the bottom left is an example of exophthalmia. The image to the bottom right is an example of dropsy. You'll notice that all the scales are jutting outwards, making the fish look like a pine cone. This is the result of subcutaneous edema. As previously mentioned, skin ulcers can be associated with osmoregulatory disturbances. This can result in circulatory collapse and a failure of peripheral perfusion. Hematopoietic tissue has a high level of metabolic activity, making it particularly prone to injury. Most viruses target the hematopoietic tissue. Examples include infectious hematopoietic necrosis virus. It's also a common site for bacterial infection. Examples include Mycobacterium and Renibacterium salmoninarum. Other causes of hematopoietic injury include toxin exposure, radiation exposure, and oxidative injury. These agents may be environmental or bacterial in origin. In addition to the hematopoietic tissue of the kidney, these agents can also cause injury to the ellipsoids of the spleen. Melanomacrophage centers are excellent indicators of pathology. With toxemia, there may be rupture of the melanomacrophage centers resulting in pigment dispersion. With starvation, the melanomacrophage centers may be enlarged with increased amounts of lipofuscin as a result of catabolism. During a hemolytic crisis, the melanomacrophage centers may be enlarged with an abundance of hemosiderin as a result of increased erythrophagocytosis. The image in the bottom right is a histological section from the liver of a shark with an abundance of melanomacrophage centers. This is the result of chronic hepatocellular turnover, which may be the result of chronic toxin exposure and oxidative injury. Erythrocytes are normally recycled in the spleen and the kidney. Fish with anemia may present with pallor in the gills, however this is not always a reliable indicator because gillotolysis occurs fairly rapidly. Anemia can occur via one of three mechanisms, which will be covered in more detail in the following slide. Hemolytic anemia is anemia that results from the increased destruction and turnover of erythrocytes. This can be via intravascular hemolysis or extravascular hemolysis. Causes may include toxin-producing bacteria, specifically bacteria that produce hemolysins, blood parasites, like Trypanosoma myrmanensis, and certain viral infections, like erythrocytic necrosis virus. Chronic hemolysis can result in metastatic hematopoiesis, where the kidney is no longer able to keep up with the demand, so hematopoiesis is outsourced to other tissues and organs, like the liver and spleen. Hemorrhagic anemia occurs with excessive blood loss. This can occur with blood-sucking parasites, like lampreys and leeches, or widespread vascular injury, as one would expect with viral hemorrhagic septicemia virus. Chronic hemorrhagic anemia will result in iron deficiency and compensatory hematopoiesis. Hypoplastic anemia is when there's insufficient erythrocyte production in the hematopoietic tissue. Causes may include nutritional deficiencies like folic acid, iron, and vitamin B12. Other causes include direct injury of the hematopoietic tissue, which can occur with radiation, bacteria, viruses, neoplasia, and certain toxins and drugs. The image in the top right is an example of hypoplastic anemia. You'll notice that the renal interstitium is devoid of hematopoietic cells, and so the renal tubular system is all scrunched up together. There are a number of lesions that can occur within the digestive system. Obstruction of the pneumatic duct can occur when there's excessive irritation via bacterial or fungal infection. This will result in epithelial metaplasia and hyperplasia, causing obstruction, which can result in buoyancy issues. Intestinal bacterial overgrowth is a condition that is either a cause or a consequence of decreased intestinal motility and maldigestion. Toxin-producing species of bacteria can cause epithelial degeneration and necrosis, followed by atrophy of the intestinal folds. Acute toxicosis can cause massive sloughing of the intestinal mucosa. This can result from certain algal and bacterial toxins. Apoptosis of the mucosal epithelium occurs in temperate species that are naturally off-feed in the winter. It can also occur in cases of starvation and cachexia. The image on the bottom right is an example of intestinal bacterial overgrowth, which is associated with epithelial degeneration and necrosis, with fibrinous exudates and intralesional aggregates of deeply basophilic bacteria. This is an example of catarrhal exudation. In adult fish, hematopoiesis is generally confined to the kidney. However, in cases of chronic hemolysis, you can get metastatic hematopoiesis, where hematopoietic tissue moves back into the liver. Biliary cells and hepatocytes share a common progenitor. As a result, when there's hepatocellular regeneration, there is concurrent biliary preductular cell hyperplasia. Unlike other vertebrates, fish livers do not contain Kupffer cells. Moreover, in cases of systemic inflammation, there's no evidence of reticuloendothelial hypertrophy, though you may see evidence of intrasinusoidal histiocytic infiltrates. As a result, the liver is less susceptible to metastasis. That being said, the liver is very susceptible to toxicity. Blood flow through sinusoids is slow, and the bile ducts are in direct contact with the neighboring hepatocytes. Moreover, bile flow is 50 times slower than in mammals. As a consequence, toxins that are excreted through the biliary system have ample opportunity to cause hepatocellular injury. The image on the right is an example of metastatic hematopoiesis in the liver. Oxidative injury of the liver is characterized by hepatocellular vacuolar degeneration. There's also a buildup of ceroid in the remaining hepatocytes as they phagocytose the cellular debris. Vacuolar degeneration is associated with a loss of liver function. The loss of liver function will result in an increased susceptibility to other toxins. There's also decreased protein production, which can result in edema and hypoplastic anemia. Other manifestations of oxidative injury include pansteatitis, which affects the adipose tissue of the meninges, the pericardium, the muscle, and the mesentery. With pansteatitis, there's widespread lipid peroxidation, resulting in the production of excess free radicals. This creates a chain reaction, which causes even more peroxidation, while also causing injury to any tissue adjacent to the affected adipose. Causes of oxidative injury include rancid feed, vitamin E deficiency, and toxin exposure. There are various types of hepatocellular pigments, including ceroid and lipofuscin, bile pigments, and hemosiderin. Ceroid and lipofuscin appear as yellow-brown granular pigments within the cytoplasm. These are indigestible byproducts of cellular breakdown. Typically, this is a marker of increased cell turnover. Causes of ceroid and lipofuscin accumulation include toxin exposure, starvation, and catabolism. Bile pigments are generally yellow-green and blotchy. An accumulation of biopigments will manifest as jaundice on gross examination. This can be the result of biliary obstruction and toxic hemolysis. Hemosiderin is a brown-black granular pigment. This is an iron-containing pigment that's produced from the breakdown of hemoglobin. Potential causes include erythrophagocytosis, hemolysis, and excess dietary iron. The image on the bottom right is a histological section of a shark liver with bile duct hyperplasia and an accumulation of yellow-green blotchy pigment consistent with bile. Cirrhosis is a consequence of chronic hepatocellular injury, resulting in fibrosis and hepatocellular regeneration. It's frequently associated with bile duct hyperplasia. Contraction of the scar tissue results in a shunting of blood from the intestine to systemic circulation. Causes of cirrhosis include heavy metals, toxins, biliary obstruction, and parasitism. Pancreatic necrosis results in pancreatic insufficiency. This can lead to cachexia as a consequence of maldigestion. Potential causes include infectious pancreatic necrosis virus. The image in the bottom right is an example of exocrine pancreatic necrosis caused by infectious pancreatic necrosis virus. Membranoproliferative glomerulonephritis is characterized by a thickening of Bowman's capsule and glomerular basement membrane. There's also proliferation of the mesangial cells and hypertrophy of the endothelium and podocytes. Potential causes include systemic infection, immune complex deposition, and diabetes. Given the highly vascularized nature of the glomerular tuft, it's particularly prone to embolization. Potential causes include bacteria, myxosporians, and thrombi. Fish can tolerate a significant amount of renal injury given that excretion of ammonia is largely via the gills. The image on the bottom right is an example of membranoproliferative glomerulonephritis in a Pacific salmon. Nephrocalcinosis is a condition characterized by calcium precipitation within renal tubules. This results in tubular dilation and epithelial attenuation. Tubular injury can result in tubular epithelial degeneration and peritubular fibrosis. Nephrocalcinosis is associated with excess calcium and magnesium in the diet and excess CO2 in the environment. There are a variety of toxins within the aquatic environment that can cause renal tubular injury. Examples include polychlorinated biphenyls, polychlorinated hydrocarbons, organophosphates, insecticides, herbicides, and polyaromatic hydrocarbons. The image on the bottom is an example of nephrocalcinosis. There are various infectious etiologies that have a tropism or an affinity for the brain. Examples include Picericaceae salmonis, Exophiala salmonis, and Microsporidium cerebralis. Systemic bacterial infections can also cause brain lesions. One of the more common lesions is exudative meningitis. Injuries to the spinal cord can result in a loss of sympathetic control of the melanophores caudal to the injury. This will result in hyperpigmentation. The image on the bottom right is an example of Myxobolus cerebralis infection, causing degeneration of the cartilage and injury of the spinal cord as a result of vertebral instability. This is why Myxobolus cerebralis is also known as whirling disease and blacktail. The presence of eosinophilic granular cells within the central nervous system is suggestive of toxic injury to the brain. Thiamine deficiency can result in neuronal degeneration and spongiosis, particularly within the periventricular and thalamic regions. The various sensory systems throughout the body are also subject to injury. The semicircular canals of the labyrinthian system are responsible for buoyancy. Potential causes of injury include barotrauma, myxobolus cerebralis, and toxin exposure. The image on the bottom left is a histological section of the semicircular canals of a normal fish. The image on the right is a histological section from a fish with barotrauma. You'll notice that the semicircular canals are filled with blood. The cause in this particular case was pile driving. As a consequence, the fish was exhibiting signs consistent with a loss of buoyancy. Any injury of the lateral line system will result in a loss of mechanoreception. Potential causes of injury include detergents, heavy metals, polyaromatic hydrocarbons, and pesticides. Histologically, you'll notice degeneration and necrosis and sloughing of the sensory epithelium. You may also notice epithelial hyperplasia and metaplasia. Given that fish use light stimuli to control pigmentation, blindness can result in cutaneous hyperpigmentation. There are a number of lesions that can occur in the retina. Retinal detachment is often associated with vitreous degeneration and trauma. Fish can also develop diabetic retinopathy, which is characterized by tortuous microvasculature and a thickened endothelium. Corneal lesions are fairly obvious on gross examination. Corneal edema can result from corneal injury. Potential causes include trauma, chemical injury, and infection. The metacercaria of cryptocotyle lingua reside within the corneal stroma, causing corneal edema. Jellyfish stings can cause so much pain and irritation that the fish will rub its eye against various structures, causing additional damage. Riboflavin deficiency can be associated with reduced oxygenation of the corneal stroma, resulting in corneal degeneration. Cataracts are another ocular lesion that's commonly seen in fish. This can be associated with phacoclastic uveitis. Potential causes of cataracts include trauma, ultraviolet radiation, and changes in salinity. Other potential causes include parasitic infection, like diplostomum, and nutritional deficiencies, like histidine, thiamine, and riboflavin. Exophthalmos can result when there's increased pressure from behind the eye. The choroid and the choroid gland are highly vascularized structures at the caudal aspect of the eye. These are particularly prone to embolization. Periorbital edema and/or inflammation can result from septicemia, localized infections, and osmoregulatory disturbances. Other causes of exophthalmos include ocular neoplasms. As previously mentioned, gas bubble disease can result from supersaturation of dissolved gases in the aquatic environment. Ocular lesions associated with gas bubble disease include exophthalmia, lenticular degeneration, phthisis bulbi, and corneal rupture. There are various lesions that can occur in the skeletal muscle. Certain species of parasite have a tropism for skeletal muscle, like Anisakis and Cadoa. There are also skeletal muscle lesions associated with viral infection. Examples include pancreas disease, HSMI, and cardiomyopathy syndrome. Wound healing in the skeletal muscle is dependent on temperature and vitamin C. When there's excessive tissue injury, contraction of the scar tissue can result in body contortions. Starvation and cachexia are associated with myocellular atrophy. Vitamin E deficiency and oxidized dietary lipid can cause myocellular degeneration and pansteatitis. Manifestations of this disease are likely species and temperature dependent. This is likely related to changes in metabolism at various temperatures. In some cases, you may see bland myocellular degeneration in the absence of pansteatitis. This is more in line with white muscle disease. The image on the right is a case of pansteatitis and myositis with associated myocellular degeneration. This was likely caused by oxidative injury. There are various toxins that can interfere with bone development, including organophosphates, carbamates, and organochlorines. Vitamin C deficiency is also associated with skeletal lesions, given that vitamin C is necessary for the maturation of collagen. In catfish, there's a condition known as crackhead, which is caused by vitamin C deficiency. The bones of the skull are thin, and there's increased width along the cranial symphysis, with associated hemorrhage and ulceration. In an effort to reduce the level of phosphorus in the environment, some feeds end up with less phosphate than is required. This can result in phosphorus deficiency. Phosphorus deficiency is associated with a failure of ossification, resulting in soft rubbery bones and pathological fractures. One of the classic lesions associated with phosphorus deficiency are skull and jaw deformities. These deformities will typically manifest later in life, even if the deficiency was limited to the early stages of development. Other things you should keep in mind when dealing with the skeletal system is that there's no haversion system in fish, which means inflammation can only occur via the periosteum. Electrocution can result in fracture of the spinal vertebra as a result of muscle spasm. When bones are fractured, the bone fragments do not realign, so the skeleton will often heal crooked. If a gravid female fails to mate, the ova are resorbed. This can be associated with histiocytic infiltrates, melanomacrophage centers, fibrosis, and peritoneal adhesions. Certain infectious etiologies can cause sterility via excessive inflammation within the gonads and associated fibrosis. The image below is a histological section of an ovary with many resorptive follicles. Endocrine glands are highly vascularized, so they're prone to toxic injury and embolization. One of the more common lesions of the endocrine system is goiter or iodine deficiency. This is particularly common in an aquarium setting. Goiter is a consequence of decreased thyroxine secretion, causing an increase in thyroid-stimulating hormone and thyroid follicular hyperplasia. The thyroid gland in fish is diffuse and unencapsulated. In some species, like cyprinids, there are ectopic follicles in a variety of tissues, like the kidney. Causes of goiter include dietary deficiencies of iodine and goitrogenic chemicals. The image below is a histological section of a hyperplastic thyroid gland, consistent with goiter. On gross exam, the affected fish had a small fleshy nodule arising from beneath the operculum,